Joining Q Alliance has been an amazing step for me. I was drawn to Q Alliance because of its alternative model of medicine. To me, it places the emphasis back on the patient rather than insurance companies or big HMOs, and it allows provider time to be in a visit with a patient, which I think is incredibly important, and then more time outside of the visit to think about what's going on and to be able to communicate with a patient and to and also to be able to communicate with other people who are involved in the patient's care. To me, this has been a big change, and I think will also be a changing influence throughout medicine. And so I'm very excited to be a part of Q Alliance and what I see as possible real change in the health system for years to come. So the model of care here at Q Alliance, to me, means that providers can spend more time with their patients, patients have more time with their providers, and therefore there's a higher quality of medicine that's able to be practiced. To me, patients have found themselves to be a lot happier here, and I hear that all the time because of the attention that they can receive. It also is a great model for the health system in general, because I think it will be able to save money in the long run and give higher quality care, which is really important and something that we're looking for as a solution throughout the country. And so I'm very excited about Q Alliance's model and possibly as a model for the rest of the country. I think the first thing that drew me to Q Alliance was how happy people were here, from the staff working here, the other providers, and then the patients as well. I mean, that was apparent to me from the moment I first walked in the door. And that is something that instantly set it apart from many other kind of healthcare systems that I've been a part of and where I've practiced in the past. But beyond that, the amount of time that you get to spend with a patient is something that's so precious to me here. And so using that time well and as a way to really strengthen the provider-patient relationship is something that I really value here and something that I see as totally different. I grew up in a small town in Vermont where my father was the town's primary care provider. And so he knew all his patients intimately, had close relationships with everybody. And growing up, I saw the incredible value in that. And that's something to me that drew me to primary care because of those really special relationships, but also the ability to be a part of a community in that way. And so for me, being in primary care allows me to have real relationships with people, to begin to get to know who they are, and to be part of the community here, which I think is really important.
I chose primary care. I previously worked as a nurse for about 5 years, and I worked with both adults and pediatrics, but really enjoyed the combination of the two. So with adults, really enjoyed the ability to have conversations and form those lasting relationships, but just the resilience of children is something that's so beautiful, and the joy that they bring is really nice. Plus, with doing primary care, you get the ability to care for the whole family, which is something that I think is really nice. And when you're able to care for the whole family, you get to integrate each parts that you learn from the different people to make care better. For me, it just means, I think traditionally people think of their doctors as somebody that you go in, you tell them what's wrong, and they immediately tell you what to do and send you out the door, versus really this more progressive model that I think we're leaning towards, not only as a company, but as a medical system, where we work with our patients to achieve a goal. So instead of people just coming in and you handing them the solution, it's more of a conversation of people's health and what it is that they want. So that it gives them more of a chance to have a voice in their care rather than just being told what to do. So I chose to be with Q Alliance because for several reasons, but as a new provider, I really liked the advocacy that they do for patients and the way that they do their scheduling, so we get more time with each of our patients, which means you can actually address people's concerns, and not only concerns at that visit, but health promotion and what things that you can do to actually improve their health in the overall scheme of things. I also really just enjoy all of the different providers at Q Alliance. Everybody's wonderful, very caring and loving, and all great providers. I really liked the fact that we were taking on more Medicaid patients and kind of more of the underserved population. So to me, when I found out that that was something we were doing, that was a big draw for me, because I had been looking at a lot of community health clinics. But the problem with those frequently is that you don't have the time that you need to spend with people to really address their needs. You have 15 minutes and they're in and out the door, but that's not most of the time what you need to improve health. You need to be able to counsel them on, the more of the day-to-day things that will improve their health. Q Alliance model of care means it's really about making that strong bond between a patient and their provider, and making sure that they have those connections they need, that we give them that extra time and really empower them to make healthcare changes that are going to improve the rest of their life. And I think that's probably the main thing, is empowering people and allowing them to take a larger role in their healthcare versus traditionally where we more or less so just give people the answers without taking into account any of their own unique pieces to the puzzle that might change how we would do things. I also like that we have kind of this non-traditional model of patients being able to reach out to us, in the fact that we can schedule phone visits if somebody doesn't necessarily need to come into the office for you to follow up on something, or we can exchange emails. It just offers people kind of this increased access that isn't typically offered, but is something that can be very valuable and save the provider and the patient both time in not having to schedule things that aren't necessary, but also opens up visits for other people that might need to be seen in the office. I know I had one patient that emailed with me, and for her it was this wonderful thing and something that's completely new, and just over and over expressed her gratitude about how grateful she was to be able to have that contact and to be able to have quick responses via email, rather than having to schedule an office visit that was like a month out and wait for something, when really you have just one question that might be rather simple that can be answered in 2 sentences.
I joined Q Alliance because I liked the time that was allotted to each patient, and the kind of the flexibility that a provider has to work with a patient. I felt like the overall model refocused healthcare on the person's needs who's in the office, instead of the staff and other extraneous issues. Q Alliance's model of care represents innovation for me. It's a completely different model of care than anything I've worked with previously. And the idea is that the care is flexible over time, both for an individual patient, but for groups of patients together, focusing on improving overall quality outcomes in populations and for the person who's at the visit. My experience at Q Alliance has been really exceptional in the access that patients have to my care. They can reach me both by email or by telephone as needed. I find that the flexibility in visit times is very helpful. And it feels to me like I'm honoring my patient's time too. And I feel like healthcare should be respectful of a patient's time and their needs, as well as the staff and physicians and providers who are involved in their care.
I like the full spectrum of medicine. I think if I was dealing with the same body system all day long, it would actually get kind of boring. So I enjoy looking at the whole person, their emotional lives, their physical lives, how those things integrate with one another, and so primary care was a natural choice for me. So the care at Q Alliance, to me, means spending time with people, getting to know them well, having the ability to deliver care in different ways, not only just office visits, but also over the phone and electronically. so that I can give good care in a lot of different ways and not have to base the care on office visits, which can sometimes be few and far between, and hard for patients necessarily to come in all of the time. So I really appreciate the creativity in the care model and getting to know people well by having more time to spend with them is really important to me. So a partnership between a provider and a patient is, in my opinion, sort of a dialogue. It's a sharing of beliefs and ideas. It's certainly not one person telling the other person what to do. It's me sharing what it is that I know through my experience and education, and hearing from the patient what they know about their own lives and situations and belief systems, and then finding a place in between those two where we can come together and hopefully enhance the health and well-being of that patient. I will say that my style is pretty casual, so I feel like I like being real with people and allowing them to feel comfortable and be real with me, and therefore have realistic expectations of what we can accomplish. I think Q Alliance is a really exciting model of care. I'm really hoping that it will be taken notice of by insurers and other healthcare systems, because our healthcare system is so terribly broken, and the model that is the most prevalent just isn't working. And we all know that, but we don't quite know what to do with it. So I'm excited to be part of something that's new and creative and really emphasizes the things that I think are most important, which are spending time with people, knowing them well, having excellent communication, and taking good care of people. And I'm really hoping that the data will show that that actually leads to better outcomes and saves money, and therefore will get the attention of other healthcare systems. Q Alliance is different from my experiences so far with other healthcare delivery systems by allowing physicians to spend time with people and allowing us time also outside of our schedules seeing patients to take care of people, not only by reading about things so that I can learn about my patients' diagnoses and how best to take care of them, but also having time to call and email with my patients so I can coordinate their care. And I've never had that time in the past because my schedule's been full with really frequent visits, and that's not conducive to good care. I have the opportunity to get to know patients in the context of their lives. So a patient isn't a diagnosis. Instead, they have their whole life story, and that affects how and when and why they want to take care of themselves. And I feel like my being able to know that and understand it, and even also in the context of the family dynamics in which someone is living, all helps me provide better care for that individual. So I've had a variety of clinical experiences so far in my career. I've worked at sort of traditional clinics. I've worked for the Indian Health Board. I've worked in Native Alaskan population. I've worked in an integrative health center with other medical doctors, in addition to naturopaths, acupuncturists, mental health providers. So I've had a lot of different experiences, but I was really attracted to Q Alliance, the model, as a way of helping change healthcare, and really emphasizing the relationship between the provider and the patient, and giving us adequate time to develop that relationship. And I feel like that is what's missing in most clinical settings, and it's just essential to the future of healthcare, both financially and the quality of care that will be provided in this country. So one of the things I think is important about the patient-provider relationship is mutual decision making. And I don't feel like I'm here to tell people exactly what to do. I'm here to share what I've learned through my experience and through my training, and then making a decision with that person depending on their own life situation and their belief systems. So I sort of like having that dialogue of these are the things that I know of, and then hearing from the patient what are the things that they know of, and what resonates with them and what what is consistent with their goals, and then making the decision together, and sometimes even experimenting. Like, let's try this, and if it works, great, and if it doesn't, let's try something else. I do have an interest in alternative medicine, so I'll often suggest a wide variety of options for treatment, particularly for chronic conditions. I might suggest acupuncture, I might suggest a visit with a naturopath or a massage therapy, in addition to more traditional therapies like medications or physical therapy. Okay. One of the reasons why I've chosen Q Alliance is they've given me the opportunity and the freedom to teach classes, which I'm really excited about, and I've done some in the past. And I'm going to be teaching groups of diabetic patients, also teaching classes in nutrition, and also teaching classes for those with chronic pain conditions like back pain. And that will include not only Western medical information about back pain and the treatment of it, but also I'll include yoga movements and mindfulness meditation, which has been shown to be helpful for those suffering from pain.
I chose primary care because I enjoy taking care of the whole family, taking care of the whole patient, meeting all of their needs, seeing them when they're well, coming in for their wellness visits, doing referrals as needed, being their advocate. That's what primary care is to me. The patient-provider partnership it takes time to develop, and it's based on trust, and based on it's somebody that the patients feel comfortable with. So hopefully, I'm that provider that that patients are comfortable asking their questions and don't feel intimidated, and are able to get their questions answered when they need to, and whatever it is that they need to know to keep them healthy. The Q Alliance model of care for me is putting patients first, and that was why I chose Q Alliance, because patients are the priority, and the providers are given that opportunity to develop those relationships with patients and make them a priority. And so patients are able to have time, longer appointments, and have that time to establish their care and to have a good relationship with their provider. Previous answer. So I chose Q Alliance because of the model of care that it has, that their philosophy of putting patients first, that patients are the priority and not the number of patients that are seen per day, was a big factor for me. I wanted to be able to provide quality care and have that time to provide that care for the patients. So that was what I chose for why I chose Q Alliance, and that's why I enjoy working here. Q Alliance differs because having that time, the time is a big factor, and having and not being rushed, between patients, having to see one patient right after the other, and really having that time to really meet all of the patient's needs, and not, you can only have one issue per visit was a very common way that other practices are run, that they only have time to address one concern per visit. And I found that patients obviously they don't always have just one concern. There's obviously multiple concerns that that need to be addressed, and we may not be able to address all of them at one visit, but we've at least talked about them, and they're out there so that they can be brought up at future visits.
I decided to join Q Alliance so that I could practice medicine in the way that I really intended to when I graduated from medical school, which is to be able to have time with patients and really get to know them and their backgrounds and their history, and therefore be able to help them to make the best decisions for their medical care. I think what sets Q Alliance apart is the fact that we have both the resources but also the time to really be able to have that patient-provider partnership and really get to know the patients, so that then when things do come up, we can help them to determine their best treatment plan, and not just treat a problem, but treat the whole person.
Alliance gives providers an opportunity to have time to find out more about the patient, because each patient is just so unique culturally, and their own medical problems and ways that they solve things for themselves are so unique. So by having time to do that, I can do a more effective job. It also provides time for us to get back to patients and talk to them without them having to physically come into the office, and make sure that they understand how to take that next step to improve their health. I really enjoy the opportunity to see people of all ages. So from a baby that is 1 day old to someone who's 100 years old, and it's also exciting to sometimes be able to see people that are all in the same family, since a lot of times their health issues interrelate to each other, and I feel like we can personalize the care more with the opportunity to do that. In Q Alliance, it's really about the quality of care rather than a quota of the number of patients a day, which is exciting for me. There are other places where I've worked where there's certain numbers I'm supposed to meet or get done with a patient every 15 minutes, and there were times when I felt like I had to change the quality of care, while here I can spend enough time with a patient. I have scheduled time to call them back. I have staff to help me get them back, and we have a great electronic medical record that helps us integrate all that so that all of us know what's going on at any time.
I chose to work in primary care because I like to take care of the whole person and offer holistic care that includes every aspect of a person, including their family life, their work life, and who they really are.
Great.
To me, a patient-provider relationship is a partnership. It's a patient and I working together to give that person the best health that they can have. It's empowering them to be able to have a healthy lifestyle. I chose to join Q Alliance because I believe in Q Alliance's philosophy of treating a whole person and having a longer appointment time so that I can get to know people and provide the best care possible. I chose primary care because I like to take care of the whole person, to offer holistic care. And I like to offer that holistic care to not only one person in a family, but the entire family, so that I can care for people from birth through old age. And when I know someone and their family, I feel like I can offer better care for that person and their entire family.